Welcome to the Smart Weight Loss Coaching Podcast. I'm Dr. Lisa Oldson, a board-certified weight loss medicine specialist and certified life coach. In this podcast, I'll share fresh insights and effective techniques for incorporating mindset, habit change, and proven science into your life. Are you ready to achieve sustainable weight loss, wellness, and longevity? Then let's jump in and lose weight the smart way. Welcome back. If you're like me and you have a family history of breast cancer, you might be wondering what you can do to lower your risk other than seeking early detection with mammography. My Aunt Jeannie struggled with class 3 obesity for much of her adult life until she had gastric bypass surgery back when I was a child. She also developed breast cancer. Excess weight increases the risk of breast cancer because it causes chronic inflammation and it increases levels of estrogen, insulin, and growth factors that promote cell growth and cancer progression. We can't change our genetic risk of developing breast cancer, at least not yet. So let's take a look at other factors we can influence to lower our risk. With 1 in every 8 women developing invasive breast cancer in her lifetime, we'd all benefit from prioritizing healthy habits that have been specifically shown to impact breast cancer risk. The American Cancer Society says that about 30% of postmenopausal breast cancer diagnoses are linked to risk factors that we have the power to change. Some studies say that as high as 50 to 70% of breast cancers can be prevented, depending on when and how aggressively we make changes in our lifestyle to reduce the risk. I don't know about you, but I'm all in for that. A 2020 study led by Dr. Walter Willett showed that women over 50 who lost as little as 10 pounds or more and sustained that weight loss over time could reduce their future breast cancer risk by 32%. I'd like to share 5 things you can do to lower your risk of breast cancer, and of course, we'll dive a little deeper into the topic of weight loss as a tool to reduce breast cancer risk. Number 1. The first modifiable risk factor for breast cancer might surprise you. It actually surprised me. It's smoking. Smoking contributes to an increased risk of breast cancer by causing mutations in DNA. The toxic chemicals in cigarettes can impair immune function, making it harder to fight cancer cells. Those who smoke tend to have more aggressive cancer cells that metastasize or spread beyond the breast. Women who start smoking at a young age are at especially increased risk of cancer before menopause. If you want to quit smoking, check out the Mayo Clinic's website for hints and be sure to talk with your doctor to get support. Number 2. Risk factor number 2 is alcohol. The risk of breast cancer increases with the amount of alcohol consumed. You might be wondering how alcohol increases the risk of cancer. Like cigarette smoking, alcohol damages DNA, causing mutations in the normal breast cells. And it also impairs absorption of folate, which we need to maintain healthy cellular tissue. Alcohol increases inflammation as well as estrogen levels. As you might imagine, higher levels of estrogen can overstimulate breast tissue, and all of these impacts from alcohol work together to promote cancer cell growth and tumor development. So to lower your risk of breast cancer, please quit or limit your alcohol and please don't smoke. By the way, in the Smart Weight Loss Coaching Program, a lot of the skills and strategies we work on to address food desire are also helpful to modify desire for cigarettes, alcohol, or other habits you might want to eliminate. But back to the things we can modify to lower our risk of breast cancer. Number 3, get regular exercise. A study based on the U.S. National Health and Nutrition Examination Survey, called NHANES, reported that compared to low physical activity, high physical activity reduced the risk of breast cancer by 44%. I'd like you to pause and consider that. 1 in 8 women is going to get breast cancer. If we had a pill that would reduce our risk by 44%, I think many of us would be clamoring to take it. Exercise is that pill. My suggestion for approaching exercise, if you're not currently getting any, is to remember that every little bit counts. It really helps to start small. Perhaps you can practice creating a habit to walk around the block every afternoon or evening. From there, you can slowly increase that habit in order to get more exercise over time. It's not necessary to go from 0 to 60, but if you're not getting some exercise every day, it's time to think about changing that in order to lower your risk of breast cancer. Number 4, follow a healthy diet. I'll say more about that later. And number 5, maintain a healthy weight. Before we talk in a bit more detail about the diet that will lower your risk of breast cancer and help you lose weight, let's hear a quick word from our sponsor. Haha, just kidding. It's still me, Dr. Lisa Oldson, physician and founder of Smart Weight Loss Coaching. If you are a regular listener to our podcast, please be sure to click the follow button on the podcast and increase your engagement by using our podcast workbook. The workbook goes along with episodes number 1 through 50 and propels you to take action to create healthy habits that will increase your health span and help you lose weight. It's available through our website at smartweightlosscoaching.com. And we're back. An analysis presented at the 2025 Endocrine Society annual meeting found that deaths from obesity-linked breast cancer more than tripled from 1999 to 2020. Having a body mass index of 30 or higher increases the risk of breast cancer by 33% in postmenopausal women. Just to give you a sense of what a BMI of 30 is, a woman who is 5 feet 4 inches tall and 175 pounds has a BMI of 30. So if you're carrying excess weight, even if you're nowhere near menopause yet, now is the time to address it. If you're serious about lowering your breast cancer risk, you'd be smart to start making some changes today. One study looking at postmenopausal women estimated that hormone receptor-positive breast cancer risk increases 12% for every 5-point increase in body mass index. So if your weight goes from a BMI of 30 up to 35, your risk of breast cancer just increased an additional 12%. That same study also reported weight-related increased risk for esophageal cancer, colon, kidney, thyroid, uterine, gallbladder, rectal, and pancreatic cancers, as well as for multiple myeloma, non-Hodgkin lymphoma, and leukemia. In fact, there are at least 13 different kinds of cancer that occur with increased frequency in those with excess weight, and postmenopausal breast cancer is just one of them. What about breast cancer recurrence and weight? A recent study of over 13,000 women with hormone receptor-positive breast cancer found that recurrence of breast cancer after treatment was increased if they carried excess weight, and the higher the weight, the higher the risk. This explains why we're seeing so much interest in the field of weight loss from oncologists. While it's clear that excess weight increases the risk for breast cancer and breast cancer recurrence, the real question is whether intentional weight loss lowers the risk. Bariatric surgical data strongly supports that notion. The risk for estrogen receptor-positive breast cancer in postmenopausal women with class 3 obesity was essentially cut in half for those who underwent bariatric surgery when compared with women who didn't. As for non-surgical weight loss, studies are clear that women who lose even modest amounts of weight and keep it off have a lower risk for breast cancer. In fact, losing about 20 pounds and keeping it off was associated with a 32% lower risk. Although our highly effective weight loss drugs are new, and it'll take some time for the results of large studies to be done, we already have some data telling us there's no difference in breast cancer reduction whether patients lose their weight through bariatric surgery or using a GLP-1 receptor agonist like Wegovy, Ozempic, Zepbound, or Mounjaro. But even if you're not taking a GLP-1 medication, please don't forget that you'll get some reduction in your breast cancer risk even with modest weight loss. By now, you're probably as convinced as I am that the science supports weight loss for breast cancer prevention. Since weight loss tends to happen in the kitchen, you'll be glad to know that the healthy diet for breast cancer prevention looks a lot like the healthy diet for weight loss. Most research on breast cancer and diet shows a benefit to either a plant-based diet, the Mediterranean diet, or potentially the DASH diet, which was developed to stop hypertension or high blood pressure. The big picture is that a diet high in vegetables and fruits and low in added sugars and processed foods should be the main focus. Women who closely follow the Mediterranean diet have a 24% reduction in breast cancer risk. As we've discussed, chronic inflammation is a key factor in cancer development because it damages our cells. The Mediterranean diet reduces inflammation and blocks that cellular damage. If you'd like to follow a Mediterranean diet, you should embrace the following foods: fruits and vegetables, especially those with the brightest colors like red peppers, carrots, mangoes, citrus fruits, spinach, broccoli, and so on. Legumes, such as beans and lentils, nuts and seeds, whole grains like oatmeal, brown rice, quinoa, and whole grain bread. Extra virgin olive oil, which contains inflammation-fighting omega-3 fatty acids. Fish, particularly fatty types that also contain omega-3 fatty acids, like salmon and tuna. Herbs and spices, which are also rich in protective antioxidants. And small amounts of dairy, such as plain Greek yogurt. Again, that's plain, not flavored yogurt. If you want to flavor it, add some fresh fruit. Plants are critical for cancer prevention, and while the Mediterranean diet allows for fish and infrequent other animal sources of protein, we want to really dial up our attention to plants. Fiber, which is found only in plants, plays a significant role in breast cancer prevention. A review of studies published in the journal Cancer found that women who consumed the highest amounts of fiber were 8% less likely to develop breast cancer compared to those who ate the least. The reason is that fiber helps to control our blood sugar and lower our levels of estrogen. Eating more fiber may also help prevent breast cancer by influencing the balance of good and bad microorganisms in your gut microbiome. When our gut bacteria ferments fiber, it makes short-chain fatty acids that reduce inflammation and block tumor development. Eating enough fiber is great for our health, for reducing the risk of cancer, and it's also helpful for weight loss. On another note, let's talk about soy because the science around soy has changed. We now know that foods such as tofu and edamame, which were once thought to increase the risk of breast cancer, actually lower the risk. So please eat edamame with impunity. It is so good for you. What about specific foods that you should avoid? You've heard that the standard American diet, also called the SAD diet, is not doing us any favors. That's certainly true when it comes to breast cancer. One of the most important things you can do nutritionally is to avoid the ultra-processed foods that have permeated our food supply. Processed meats like bacon and hot dogs, as well as red meats, have been associated with a higher risk of death from breast cancer. It's wise to avoid too much cheese or butter, as well as saturated fats in other foods like beef, pork, chicken, palm oil, coconut oil, baked goods, and fried foods. Excess sugar should be avoided too, including candy, cookies, pies, cakes, and also juice and soda. While some meat and high-fat foods can directly increase the risk of dying from breast cancer, sweets are typically high in calories and contribute to weight gain, insulin resistance, and inflammation, which we know, in turn, raises the risk of breast cancer. As for weight, adopting a plant-based diet or a plant-forward approach like the Mediterranean diet will certainly help with weight loss. And of course, I'm here to help too. Let's shift gears and talk about your NBA, your next best action to lower your risk of breast cancer. While you could commit to a massive nutritional change today, like adopting a whole food plant-based diet, feel free to start smaller. My MBA, after reviewing all the research on preventing breast cancer, is to eat something with either beans or lentils with vegetables for my next dinner. How about you? Thanks so much for listening. If you'd like more support during your smart weight loss journey, check out our group coaching program at smartweightlosscoaching.com. Until next time, stay well and stay smart.